you have so many reds on your training on ASR, then you might not be covered, because at the end of the day, it is your responsibility to make sure that all of your trainings are up to date. They've provided the e-learnings. Hi, my name is Olubukola. Thanks for staying tuned. I'm a nurse, I'm a vlogger, and if any of my content interests you, you can go through my content. I will be leaving some of the things I've done in the description box. Please be sure to subscribe to my channel. Let's be friends on YouTube. Drop me your questions at the end of the video and we'll take it from there. Right, some weeks back I started a series on career progression, and I started it on a note of CV writing. So if you haven't seen this video, I will put a link to the video in the description box for you to have a quick watch. You'd never know, you could pick a thing or two from it. So having said that, I will just run into what we're doing today, and it is revalidation. Like I said, it is expected of you to do this and it is not optional. I will be showing you using slide presentation, and I will try my best to break it down as much as possible. However, I would like to mention a few key points before we get into the slides. Right, and the first thing is, it is entirely up to you how you want to go about it. But because I understand that some people would rather, begin to put their files together, their information together as they proceed, that is why I've put this video out. Some people are able to manage, getting everything done, put together in just a month. Some people a week, some people 2 days before their revalidation date. Irrespective of the method you choose, NMC would normally send you a notification via email or via your registered address. So it is highly important that you have an up-to-date address on your NMC account. Make sure that every details on your NMC account is up to date. Once you receive the notification from NMC, you are obliged to go to the NMC online and begin your application process by filling out the application form. So that is the first step, and there are downloadable documents that you're expected to use in the guide. I will be showing you everything I mean very soon when I begin my slideshow, and you will be able to put things to perspective, especially if you haven't done this before. If you've done this before, you pretty much know what I'm talking about. But this video, like I try to do in all of my videos, is to make it beginner friendly, or for people that don't know how to go about this thing. At this point, it is important to mention that the deadline for submission of your revalidation application is the first day of the month in which your registration expires. So say you normally renew your registration every 30th of October as an example, so your revalidation expiry date is the 1st of that month. Right, and if you have successfully completed your revalidation, your registration will then renew on the 30th of October like it normally would. Speaking of the things you need, like a checklist, you need a portfolio. I will be getting into it as I start the slides. You either need an e-portfolio where you keep on your system, or you need a folder like any clear bag or any kind of folder where you can print and put documents and evidences in, or your professional portfolio, whichever one. You can have your professional portfolio where you keep things, like a file really, but they call it portfolio. So or you could just create another portfolio or another file just for the purpose of revalidation only. It is entirely up to you. Another thing you need is a confirmer. Your confirmer could be your line manager. However, if for whatever reason you do not have a line manager, you could use a nurse, midwife, or a nursing associate that is registered, because they will be tendering their pins, their signature, and all of that. So they need to be actively registered with the NMC. Another good thing about who to use as a confirmer is they don't have to be your line manager. For instance, if your line manager isn't a nurse but is your line manager, MC has advised that you can use such people. However, if for whatever reason you can't get a nurse if you're a nurse, or you can't get a midwife if you're a midwife, and for whatever reason you don't have a line manager, you could use other people from the healthcare profession as your confirmer. I will be putting a list of people that you can use, and as you can see on my screen right now, you can use a heart therapist, biomedical scientist, chiropodist, dentist, doctor, dietitian, optometrist, orthodontist, and the list goes on. However, if for whatever reason you do not have a line manager, you can't get a nurse if you're a nurse, or a nursing associate if you're a nursing associate, and you need to get it done, and you can't get any registered healthcare professional to do it for you, what you could do is also use people from this list that I will be putting on the screen as confirmed by the Nursing and Midwifery Council UK. And these are the people like accountants with professional qualifications, acupuncturist, and the list goes on, surveyor with professional, qualifications. If you do rely on someone from this list to act as a confirmer, you are more likely to be required to provide more information as part of your verification process, because the NMC would like to know why you had to use, someone from that line of job. Right, now that we know the list of confirmers, it is important that you keep your portfolio and take it along with your confirmer. Make sure that whatever you keep in your portfolio does not identify with any person, whether a patient or a colleague or whosoever it is, for the purpose of confidentiality. Also, your portfolio, if at all you're somebody that chalk things out, make sure you keep it for at least 3 more years. That's keep it until your next revalidation date. That way you have a new revalidation and you then have like a more up-to-date paperwork, like portfolio put together. But before then, please make sure you keep it. I don't see why you should chalk them, but I'm just assuming some people might be that way. Just keep them, because NMC might require evidences, and you will be required to send some down to them or to scan some down to them. So make sure that you do not destroy your evidences, and indeed you have your evidences. Some people might be wondering if NMC normally won't require those evidences at the point of submission. No, they won't. They won't ask you to upload anything at all until they probably need to get further evidences. Remember that you have your confirmer there to go through your portfolio with you, and your confirmer will be signing that indeed they've done that, and indeed they will be presenting the NMC pin, so they have become accountable right there. So there is someone looking at it anyway. Another thing that some people are a bit wary about is the fact that there might be conflict of interest. So in a situation where you feel like you're not, I don't want to say, but you feel like you're not being liked by your manager, or you feel like there might be bias in the way your reflective practice will be done with you and the way your confirmation process would go, it is highly advisable that you use somebody else. I'm mentioning this option just as presented by NMC themselves as well. There might be risk of say conflict of interest or bias or judgmental coming into play. So in such situation, just go ahead to use somebody else. So people often do their appraisals alongside their revalidation, because remember that with appraisals, your employer, in the place of your manager as an example, would assess your performance against what is expected of you, especially in line with the role that you've been employed for, and then identify areas of improvement or development. So having said that, you can do your appraisal at the same time as your revalidation, because remember that with your confirmer you will be going through your reflective practice as part of your revalidation process. This can apply to you if the person acting as your confirmer is who would normally do your appraisal. In a situation whereby for whatever reason you've had to use a dentist as your confirmer, obviously they can't do your revalidation because they are not your employer, or they are not sitting in the place of your employer, if you get what I mean there. So if you normally have irregular appraisals, it is worth trying to get an appraisal date on the same date that you're going for your revalidation. Talk with your confirmer, who is your manager in this case that I'm trying to explain. So NMC recommends it that your confirmation discussion forms part of your appraisal for that year. However, as much as you can incorporate both, you don't have to bother yourself if for whatever reason you can't get your appraisal done on that date that you're doing your revalidation. Remember that your revalidation has to be renewed or has to be done at that point in time, and especially if your appraisals are irregular, your appraisals can be done after or before. These are the things that you will be needing to renew your registration every 3 years with NMC. First, if you're a nurse or a midwife or a nursing associate, you will need 450 practice hours for each registration. But if you're practicing as a nurse and midwife as an example, you will need 900 hours, because you need 450 per registration. And what it simply means, even before we get to the slides, is that indeed you have practiced, like you've done the work, you've been hands-on, or whatever it is you do as a nurse, you've done it for 450 hours within the past 3 years. Also, you would need 35 hours of continuous professional development, of which 20 hours out of the 35 has to be participatory. So what do they mean by continuous professional development? So say if it's an online learning, a course, self-learning, things like that, or you attend a webinar with any professional organization that has been CPD registered, those hours can count towards your CPD. Participatory CPD hours, according to the NMC document on how to revalidate, is just those hours that you spend with people, with one or more professionals or in a larger group setting. You sit down to attend a course, whether a seminar or a webinar, whatever course it is that you've had to sit with professionals or with your colleagues, in a group setting. That's what the participatory simply means. While the remaining 15 hours will be for personal learnings, like you did some courses on the RCN website and all of that, things like that, that are all by yourself, that you did at your own time. The third thing is to collect 5 examples of practice related feedbacks. So things that has been set back to you, like a compliment, a patient left the ward and left you all a card, something like that can count to 1, but don't make it more than 1, something like that. A personal card that has been given to yourself, or a patient mentioned your name on the PALS feedback, or there was an inspection done. It could even be a complaint, things like that. But I know we all like positive vibes. We like to write positive things. If it's a complaint, remember that you're going to be reflecting. So you reflect on practice, that indeed it was a complaint, and then you assess the situation. You did better, by attending a training or doing an online course, which has added to your CPD hours, and now you've added it to your 5 feedbacks, and now you're going to be mentioning it even in your reflective practice. So it really doesn't have to be good. It could be a complaint, but if it's all good, and it could be an incident report, it could be anything at all. Any 5 example practice related feedback. Fourth thing is writing 5 reflective accounts. So it could be from your continuous professional development that you attended, whether the participatory one or the personal one. Could be from your feedbacks that I mentioned earlier, saying you can pick any of those things, whether good or bad, and reflect on it, how it made your practice better, how it made you read more, how it made you look out for more, and all of that, and how you're now better, things like that. Also, it could just be from an event that you haven't highlighted anywhere in your CPD or in your 5 feedbacks that you mentioned earlier, something that has happened randomly. For instance, at the start of my practice as a nurse, I was going to take a patient down to the theater. I then turned off the syringe driver that was administering insulin to the patient, just to maintain their blood glucose level. I then turned it off and wheeled the patient to the theater, only for it to be highlighted that why was the syringe driver taken down, and blood sugar checked. Blood sugar had either gone high or gone low. You were probably told off and you were asked to take the patient back to the ward to stabilize the blood sugar level, and then bring the patient back when they are more stable, if you get what I mean. So that is an example. And then you've probably read more about insulin, or you probably had to read more about glucose, potassium, and insulin, or whatever the case is. And that way you've read more, it has affected your practice. Indeed, it wasn't a very good thing that happened, but what happened, it made you go to read more. And what has that done? It has informed your practice positively, and now you can do it better. You can tell somebody better that, oh, don't do that because I've done that before and this would happen, So anything that you've done that has helped your practice get better because you've had to learn is brought about learning. So that is all it's all about, really. Also, in writing your reflective practice, you will mention which of the codes it is related to, whether practice effectively or prioritizing care and people, whatever it is, you have to mention it. You could check the code online, and you'd see the one that goes or matches best, and you need to hyphen and put it in front of it, practicing effectively. Next is the reflective discussion form. So you need to use the one provided by the NMC. Just like every other form, it is advisable to use the one provided on the NMC website. So it will have the name, the PIN, the signature and date of the nurse, that is confirming that you had the reflective, discussion with. Each of the 5 things that you mentioned earlier, or that you've written down, you have to talk about it with your confirmer. A summary of everything that has been discussed will then be written, and there will be a name, signature, and all of that, put against it. So that form is also available for you to fill, and it is a part of your revalidation. Another thing is your health and character declaration. As part of your online revalidation application, you have to tick that you find your health and character section needs to be completed, as well. You will see what I mean when you get to it. When you open it, everything will all come to perspective. So it is okay if you look blank or you really, can't bring them all to, perspective just yet. When it's at that bridge, especially with this video, you could just open it in front of you and you cross it really. Another thing that makes up your revalidation also is your professional indemnity arrangement. So you get indemnity cover from, say, your trust or from a professional body that you've registered with, say RCN or Unison, or if you've got a private registration with any body, you need to mention it. You will record the name of the professional body or the provider. So something I need to say at this point that is highly important: for you to be fully covered by your trust, you indeed need to be up to date with all of your trainings, because God forbid if anything happens and you think, well, I've got indemnity cover. Well, let me shock you. If for whatever reason your medication e-learning is not up to date, so training you were supposed to go for is not up to date, you have so many reds on your training on ESR, then you might not be covered, because at the end of the day, it is your responsibility to make sure that all of your trainings are up to date. They've provided the e-learnings, you can book dates for the face-to-face trainings and all of that. So it is left to you to take the responsibility to take time out to do them all. So if for whatever reason you are so busy and you do not have the time to go do all of these things, and there was a really bad medication error, caused a severe risk, or probably a moderate to severe risk, or that probably caused death, God forbid, and they see that your medication trainings are not up to date, my dear, you're not covered, because you're supposed to do them. So if you've ticked all them boxes and you're on, well, the worst is amber, but if you try to stay on green, oh, very good. So if you're on green, everything is up to date, they will check that, then you are covered indeed by NHS. But some people don't know. If for whatever reason you're on amber, or God help you, you're on red, and you probably commit some errors relating to some things that you're on red on your training, then you're not covered, because they've provided the trainings but you haven't gone for them, so it has become your fault. Please and please be wary of that. Last stage is the confirmation. So that is when the person doing this would sign and date and do all of that, and that is you pretty much done. So if you still want a pretty breakdown of everything that I'm talking about, then I will end this video here, and in my next video that I will be posting like almost immediately, I will show you how to do everything on a breakdown level. And I understand, like I always say, we are all at different levels of understanding. So if you know it well, it doesn't mean everybody knows it well. So I try to put this into consideration, and that is why I try to simplify my videos as much as possible. Having said that, thank you so much for watching this bit of the video. I really hope it's been helpful in a way or the other. If indeed it has, please be sure to like this video, share this video to a nurse, midwife, or nursing associate that needs to see this and prepare towards their revalidation. Are you a new nurse in the UK? Are you an international nurse, overseas nurse? Are you a UK nurse yourself? Whatever kind of nurse you are, at some point you will be revalidating, and you will show in this video and other documents provided by NMC or through the RCN. Thanks so much for watching. I will see you in my next video. Take care. Bye.